My name is Dr. Manuel Dayrit. I am the Dean of the Ateneo de Manila University School of Medicine and Public Health. I am the principal investigator of a collaborative project of Ateneo and Keele University of the UK in a project called iPrime, a transformative postgraduate professional development program for primary physicians in the province of Northern Samar. In order to understand how primary care physicians function, we did an ethnographic study to observe 18 primary care physicians in their place of work over a period of 2 weeks. There were 5 themes that we identified: their multiple roles, their professional self-identity, the barriers to providing care, their learning needs, and the political issues that they had to face. We were able to develop a competency framework, which included the competencies that they needed in certain areas. We proceeded to propose a curriculum that would strengthen these competencies that have been identified.
The competencies developed by iPrime is actually really significant for people, particularly doctors who are in rural and remote areas like Northern Samar. Giving them a module that will be implemented in their workplace will be very helpful because it can increase their capacity as physicians without taking them away from their work.
It's sort of like a give and take. We test the module and then they tell us how we can improve it, and then we roll it out again. And in the process, I think both of us learn from it. Yeah. In the Philippines especially, I think doing ethnographic work in health is sorely lacking, and it's important because we have quantitative data, but we have little understanding on why these disease trends happen. And I wish to be able to convey this method of doing research to students and to my peers.
So this project is right into the human resource development of field physician in government. Because the iPrime looks at it at the front line, it will be a good project to give information to the Department of Health that this is really the actual situation and these are really the needs. Because it is no longer acceptable to have inequity. They're now talking about making access universal and making health as a right for everyone. So this kind of study and this kind of project brings out the gaps that have to be filled.
Because of the expertise of Keele in training general practitioners, we were able to learn more about the UK health system and to see how certain components of that system might help us in our own health system. This project took 2 years to complete, but as a result of it, we now have a competency framework for systematically approaching how to better train them, prepare them, and continue their professional development. Because the universal healthcare law in the Philippines actually makes primary care its foundation. And what better foundation is there than the municipal health officers and rural health practitioners? So we think that our results can be shared and eventually uplift the practice of primary care in the country.